Hi, and welcome to this rather unusual version of Frank and Mary here in Westborough. As you know, my co-host is Shelby Marshall. She's on the other screen. We have been doing this show for a while now, for I think over a year, trying to talk to seniors about issues that are of real concern to them. But we realize that what we should really be focusing on right now is what everybody is focusing on, which is really COVID-19 and how we deal with all of the stresses involved with dealing with COVID-19, especially if you're a senior. So we've started to try to redo the show. First of all, we're obviously working remotely. I'm in my office in Marlborough, Shelby in hers in Westborough. We have a wonderful guest that Shelby has invited on specifically to talk about these issues. And then at the toward the end of the show, we'll talk some more general issues that you might be wanting to consider while you're at home. And maybe talking a little bit about who else we might be having on in later editions of this. We're also thinking that we may be doing this show weekly for a while because the world is changing like daily, just to try to update people as all of this COVID-19, whatever it is, lockdown or whatever we're calling it, continues. So Shelby, whom do we have today?
Well, good morning, Arthur.
And welcome on.
Yeah, good morning and welcome to all of our guests. Appreciate for you joining in, and happy to be able to bring sort of these special additions, if you will, to the community. We are really fortunate to have on as our guest today our Director of Public Health, Steve Baccari. Good morning, Steve.
Morning, Shelby. Good morning, Arthur.
We asked Arthur to come on, we asked Steve to come on and give us a timely update. Today is the 25th of March, just for those that may be watching this on a delayed replay at some point. And asked Steve to give us an update. I do want to commend all of our staff at the in town departments and all of their direct reports for the unbelievable job that they're doing to keep us safe and keep us informed. And Steve has really been thrown into a huge learning curve around this, as we all have, and appreciate his help. So Steve, let's get right into it. You've been updating the Board of Selectmen and others on a regular basis. Last night we had a great meeting. I would encourage viewers to watch that meeting. Again, that was the meeting on the 24th. You can watch it on replay on Westborough TV. But Steve, give us an update today of number of diagnosed cases in town, please.
Sure. So, as of today, we have 3 confirmed cases. Those are people who have tested positive and are being isolated. All 3 of those cases are recovering well in their houses. We don't have any hospitalizations as far as I know at this point. So we have 3 right now. Now, one thing people get a little bit can get confusing is that terminology sometimes. So we use the terminology isolation and then quarantine kind of intermittently together, but they do have a different meaning. Isolation is someone who's actually sick with symptoms. It could be someone who tests positive, or it could be someone who may be a close contact to someone who has tested positive that we're assuming is positive for that disease. So when I talk about numbers, I mean that we have 3 confirmed cases, but we also have 2 people who are symptomatic that are close contacts to people who have been positive. So we're treating those people as positive. They're in isolation right now. Again, they're in their houses, relatively comfortable in recovering.
So, Steve, you mentioned a term that I've become familiar with now, but I think our viewers should understand this whole term of close contact. So talk to our viewers a little bit about that. What does that mean?
Sure. So the way the state has asked us to interpret a close contact is from the date that a case becomes symptomatic. A close contact would be someone that they've had interaction with while they're symptomatic, within 6 feet, and what they say is for a prolonged period of time. The 15 minutes has kind of been thrown out there, but there's no, you got to kind of work your way through some of this stuff, but that's the definition. So people that are worried about, contracting coronavirus, that's kind of what we use as the of how we track back contacts to people.
So let me just pause just so our viewers really understand that. So if you are at home right now and many of our seniors, they're couples, they're caring for each other, and there's an individual who is symptomatic, fever, coughing, difficulty breathing. Steve, anything else you want to add to that?
Those are the main ones
Okay.
right now. That there's some others being kicked around, but that's kind of still what CDC and DPH are using as the bellwether symptoms.
Yep. And in terms of fever, well, I'll talk about kind of that in a moment. But if you are with someone that is symptomatic, um, again, close contact could be, you've probably been in close contact with that person. But if they're not, excuse me, if they're symptomatic, that close contact could have been a couple minutes. If they've sneezed, you got to kind of consider it, even if it was a couple minutes. So I wouldn't use the benchmark of 15 minutes if would you agree?
Yeah, I'd agree. I mean, in all these cases, the household contacts are generally considered close contacts no matter what. So those household contacts are put into quarantine, which is an isolation. Quarantine is someone who has no symptoms, is healthy, and but we're worried about them developing symptoms over a period of time. And generally, quarantine is for 14 days.
Yep.
If someone is put into quarantine, we do monitor those people. We call them every day. We ask them to take their temperature twice a day. Ask them for respiratory symptoms. So we do monitor that throughout the full 14 days. And if at the end of that time period, temperature is fine, respiratory problems are fine, then we release them from quarantine.
So if a person is symptomatic, they have not been tested, what would your advice be to that person?
Yeah. I think the best advice we can give right now is call your primary care physician as far as what they think is best for you. They can get you tested. A lot of the testing sites still need approval from the doctor to get you in there. So that's kind of what we're telling people right now is obviously your primary care physician knows your health history and all that too, a lot more information than I would know. But please reach out to your doctor if you think you need to be tested or that you may have it.
Sure. So, and I think that's important because we're hearing more and more. You can't turn the news on without hearing about more testing available, which is as a result, we're going to see the number of positive cases rise. It's just how that cycle is going to work. But folks cannot just go and say, I want to be tested. It has to be ordered by a physician. I think that's important for folks to understand. So you're calling your primary care physician, talking about the symptoms that you're experiencing is going to be your best kind of first step toward in that process.
Yes, that's correct.
And Steve, can you tell us, so what is the closest test site if people are going to be tested?
I don't have often the people are being shuttled to where they have an affiliation with their doctors. So I think UMass Memorial is testing. I think there's a testing site in Shrewsbury near CVS, but I think that's only for first responders. So there's numerous sites around, but some may not be open to everyone. So I'd rather not give out too much information. I'm not sure they all service the same group of people.
Right.
So people should really be asking their physician to figure that out.
Yep.
Okay.
So let's kind of go forward to a little bit about what's happening behind the scenes from your lens, Steve. I think the public sort of wants to understand that. I know I certainly have received questions around, well, what happens when there is a positive test for someone who lives here in Westborough? What's the role of the Board of Selectmen?
Sure. So if a resident of Westborough tests positive, we receive notification of that through an online system, which we've been a part of for many years. It's not only for coronavirus, but for any communicable disease that someone in town would test positive for. We get notification. And so what we would do is reach out to that resident, obviously tell them that they have to stay in isolation. And then we do a thorough interview as far as contacts within the time period where they were symptomatic, right? So we'd ask for, primarily household contacts, usually pretty easy to find out. But you're also worried about potential work contacts if they were at work while they were symptomatic and there were people, in the vicinity of where they work, or other contacts if they went to some kind of gathering, things like that. We'd be asking for that information. If we did compile a group of names. We would reach out to those people. If they are in another town, we would notify that Board of Health, and they would do the reaching out to those people for quarantine. That's in a nutshell kind of how it works. And then, as I said before, once someone is either isolated or quarantined, we do follow up with those people throughout the whole period of whatever period of time they need to be quarantined for, or isolated. So we're calling them on a daily basis, making sure that symptoms aren't getting worse, that sort of thing.
Sure. Okay.
So,
good.
So Steve, as this relates to kind of inter-community, so if you've got someone here who is tested positive, and you've got a list of people, and some of those people are from out of town, you're actually going through that town's health department, and that town's is reaching out.
Correct. So we can share our cases with the appropriate people in other towns as far as if they have residents there. So again, this is all confidential. The boards of health have been doing this for a long time. But if there was someone in Marlborough, I could share my case with the Marlborough health nurse and let her know who that person is and where they live, contact information, and they would be responsible to reach out to that person to quarantine them based upon the information we give them.
I see.
So, Steve, can you just go a little deeper in terms of the privacy piece? Because, one of the natural questions, if, for folks living here in town, they're like, oh my God, we have 3 cases. Where does the person live? Where have they been? Why isn't the Board of Health giving us more specific information about that person? And there is that thing called HIPAA, and it's for good reasons.
Yeah, and we can kind of try to walk a fine line with that. We want to get information out about, to people who we think is needed, but we don't want to give out so much information in a town like Westborough where maybe you could actually figure out who it was, especially when the caseload is so low right now. If we get hundreds of cases, well, then it's a little tougher to see who it is. But we are going to start publishing twice a week reports. We talked about that last night with the Board of Selectmen on things like number of confirmed cases, if those people were housed if they were in their home recovering or in the hospital, who has come off of the isolation and quarantine list, not who, but numbers. Mm-hmm. We are going to, I think, look at also at some point, maybe publishing something according to precincts, so where people, so we could, but we're not that, we don't have numbers right now to make that an effective analysis tool. I think that was kind of decided last night. So, we can give out the ages of people. But we really want to try to protect people's health at this privacy at this time, mm-hmm. and not give out too much. And especially since the cases are so low, it's a balancing act. I understand people's concern.
Right. But I think the important point is that once a person has tested positive, the public should understand that Board of Health is monitoring those individuals. They're either in isolation or quarantine, depending upon symptomatic, asymptomatic, close contact, etc. And they are staying home, so they are not sort of out and about in the world, potentially infecting other people.
Correct. So what I would tell people is, if you are worried about being exposed, if you fit the model of someone who is a close contact to someone who is positive, you should have been contacted by the Board of Health. If you have not been contacted, then you are not considered a close contact, and at least from a direct contact perspective, you are not don't have to be quarantined or isolated.
Okay. And for folks that work in Westborough but don't live here, or for employers that are here, employers may or may not be contacted by the Westborough Board of Health. If, let's say, someone lives in Hudson and they test positive, but through the interview by the Board of Health in Hudson, it's determined, yes, they're positive, but they haven't been working, let's say, for 2 weeks, right? And they've been home for whatever reason, working from home. There's a pretty good chance in this limited scenario that your office wouldn't be contacted. So if they were my employee, I wouldn't ever be notified of that individual, correct?
Correct. Yeah, we're probably not going to know of every workplace where there is an employee that tested positive, just because, a lot of the workspaces have a lot, people from outside of Westborough working in them. So, that could certainly happen, Shelby.
Yep. Arthur, do you have any other questions for Steve? I have one more, just regard to our first responders.
No, I just think it's great through you, Steve, to have people really be getting an understanding of what's kind of really going on, right? On a day-to-day basis. It's just terrific.
Yeah, and we're here to answer questions. The phone doesn't really stop that often nowadays. It's on mute right now, so you don't. I will get back to you if you have a question. Just please be patient. Sometimes we're working from home, and I'm getting the voicemails, or sometimes you're going to be put in a queue. But I do call everyone back. So if you have a question, give me a call. I'll try to answer it the best I can.
Okay. Steve, just a quick question with respect to our first responders. They are our first line of defense: fire, EMTs, and police. DPW aren't first responders, but they are essential workers in many ways. But for our first responders, what precautions are they taking? Can you talk a little bit about the screening?
Sure. Well, I know that right now, the fire department, if you were to call for ambulance service, they would screen you for, symptoms and also, I think, travel history right now. So if you were to tell them, hey, I got a fever, respiratory symptoms, they would take personal precautions when they show up. My understanding is obviously the EMTs will have, the proper precautions, which I think is mask, gloves, maybe a face shield. I'm not totally sure what the right it is. And I believe if you have those symptoms, they are putting a mask on you also as the patient, and then for transport. So that's one of the precautions they're taking right now.
Right. And just for folks that if a loved one is transported, there's a very good chance that you as the loved one cannot accompany them as you might normally do in your own vehicle to go to the hospital, because so many of the hospitals have shut down visitors. So that would be something that perhaps the EMTs could provide you with advice about. And maybe that's a question for our next show, Arthur, is, how does that happen, right? Because we have a loved one going to the hospital, the first instinct is to follow them, but right. that's being severely limited right now. So
right, that's a great idea.
Steve, thank you for your time. We'll let you get back to that queue that's probably building. Really appreciate all the work you're doing, and that you continue to be a resource to the public. Thank you.
Well, thank you.
All right, have a great day. Bye.
Steve, a real pleasure.
Bye-bye.
And so we're back without Steve Baccari. And once again, we just both really want to thank Steve for coming on to the show. I think so many people are trying to figure this out. You see it all on TV and you see it at the macro level, but to actually try to figure out what's going on, are you safe? If you see one of your neighbors out, can you feel safe so to actually understand what that system is, and from the perspective of people's privacy, knowing that if there is a problem, you're not necessarily going to become like a target in the neighborhood, right? Because everybody kind of knows that you've got an issue or thinks that you have an issue. So this was really great. Right. So Shelby,
so Arthur, one of the things we've talked about on previous shows is the healthcare proxy, and I have to believe that now more than ever, it's important that folks have their documents, their legal documents, particularly the healthcare proxy, in place. Can you talk to our viewers a little bit about that, and how could they quickly do that if they don't have one?
Right. So once again, kind of quickly, most people that I speak to, most seniors, as opposed to the general population, have a healthcare proxy. They have done it. It's someplace. They just may not know necessarily where that is, right? And how long ago they did it. So when I'm advising seniors right now, I really kind of talk about, first of all, if you've done a healthcare proxy, go find it. Right? Go find it. Chances are it's in this pile of documents, someplace that you put it, right? And if you can't find it, go talk to your lawyer, because chances are your lawyer has a copy of it, or talk to your doctor so that you make sure that it's available, because the last thing you need is to have an emergency and to be needing to go to the hospital, and maybe you're incapacitated, right? And that's why you're going, right? And they get to the hospital, and no one knows who to talk to, because you're incapacitated, and everything just gets frozen up. That's the last thing you need right now, right? So you want to have that healthcare proxy. You want to have it available, right? You might even want to put it on your refrigerator, but you at least want to have it. ideally, you also want to have your doctor have this, right? Because if you don't have it with you, right, then at least if you get to the hospital, the doc, if the hospitals can get a sense of who your attending physician is, they're going to be able to reach out to that doctor. The doctors are going to be able to get the information to them.
Great point.
So that's the first. But at least as important as this, I'm always talking to people who say they'll say, well, have you got your healthcare proxy? Well, yes. Well, have you talked to your person about how you want to be treated if there's an emergency? Well, often the answer is not so much, right? So this is the time finally, right? I'm sure that if your spouse is your proxy, I shouldn't say I'm sure, chances are you really have had a conversation with them about kind of how you would want to be treated if this were an emergency, because this could be an emergency. As you know, people die from this, not a lot of people, but people die from this, right? Quickly, right? Or, over short periods of time. So if there's someone that's going to be making decisions for you, they need to be knowing what kind of decisions they want to be making. So if it's your spouse, that's one thing, especially if it's one of your children, right? Or if your child has been the backup, so you never really thought you needed to talk to them. Well, it's time to talk to them and to give them a sense of if there's an emergency, if you're in the hospital, if there are certain treatments that the doctors are recommending, how should you be responding, right? What are the things that are really important to you at this stage in your life? Maybe you're right now extremely healthy and you're not worried about any of this. Maybe you're not so healthy. So you need to be having those conversations, right? And now is the time. So that's kind of the message.
Okay.
So Shelby, now I want to ask you, right? Because you do this for a living, right? You take care of people. You're taking care of people all the time, right? We've got all these people who are really stressing out.
Yeah.
Can you just kind of talk about for individuals what they should be doing to take care of themselves, and especially for caregivers, what should you be doing right now? Right?
Sure.
I mean, I keep talking to clients about just, this is just a real good time to call that elderly aunt that you haven't spoken to, who lives by herself and is freaked out, But can you just talk about that a little bit? I think they're really important issues.
So I think it's important now than ever, ironically enough, that with social distancing, we actually need to be virtually or telephonically reaching out to folks to just check in on them. So I think that that's very important. I know that that's happening in the community, but I mean, even if you have an elderly neighbor and you don't know their phone number, drop a note off at their door in a plastic bag, just thinking of you. If you need anything, here's my number, please call. Because folks, some people might be too afraid to just go out and go grocery shopping. And so maybe you can help them with that. But from a practical perspective, what we've been talking to our families about, and certainly our caregivers, families who are caregivers and our professional caregivers, there's some really practical things that you can do in your home, even if you don't have an army of Clorox wipes or hand sanitizers. So number one, wash your hands, wash your hands, wash your hands. Maintain social distancing in your home if a person is symptomatic in any sort of ways, but the practical nature is sometimes couples are providing care for each other. So if you have to go and help someone get out of bed, you've got to be physically touching. There is no social distancing in that situation. So if the person is symptomatic, have them, you probably don't have a mask at home, that's okay. A bandana covering the nose and the mouth is, even if it's this kind of thing, with the person holding, if you don't have a way to kind of bring it around your whole face. And then when you're done with that, guys, I'm sorry, the handkerchief is the worst thing that was ever invented. That goes in the laundry. It doesn't go in your pocket because it's a piece of cloth, but it can be washed. It doesn't have to be thrown away. If you're worried about the telephone, right, you're worried about using your phone, someone may have touched it, take a piece of paper towel and cover it over. So your face is touching the paper towel. That's a completely appropriate and safe barrier. And then when you're done with the phone, wash your hands. Wash your hands, soap and water. If you don't have a bunch of alcohol wipes or even isopropyl alcohol, 60% alcohol, don't worry about it. Soap and water is like one of the best things that you can do. Keep surfaces clean in particular. You can wash all your clothes with the other person's clothes, even if they're positive or symptomatic. So that's not an issue. Just wash them as normal. You don't have to do anything special. You don't have to throw clothes out. Just, be practical. But I do want to make sure in the time that we have remaining, just got a document here from the town. I want to refer to it, that please don't take your wipes, if you're using baby wipes or Clorox wipes or any sort of wipes, and put them in the toilet. Every day we have our DPW staff that goes out and check what are fascinating pieces of equipment called sewer grinders. The grinders take all the stuff that goes down through our sewer and grinds it up. And those wipes, even when they say they're disposable, are not good for the system. So throw them away. Please don't flush them, because the one thing we don't need are sewer problems on top of what we already have. If you are at home and you need assistance, I use the grocery shopping as an example. Call the senior center. They are taking calls. They're available to help. And there's an army of volunteers waiting in the wings to help folks with errands and doing what needs to be done. The senior center number is 508-366-3000. That's 508-366-3000. If you're just not sure, call them. If nothing else, you're going to get a friendly voice on the phone who's going to ask how you're doing. And you can also be on a call check-in list. Last I knew, that number was about 150 people they were calling and checking in on regularly.
Which is like a huge deal, huge deal.
Yep.
There's one other thing, just going back to some of your questions, Shelby. So there's a mass.gov, the mass.gov website.
Yep.
If you want to download a healthcare proxy, you can go to that website, right? Or, talk to your lawyer or talk to your doctor. They're going to have these documents available, right? So if you hadn't done it to this point, you want to try to get one, right? Or have one of your kids drop one out, just have it available. It's just really, really important.
Great.
So Shelby, I think, we were talking about a whole bunch of different possible guests that we want to be having on. I guess I would just suggest to people kind of stay tuned. We really appreciate the help of Aidan and Karen and the other folks at Westborough Cable for being willing to do this. Because we know there are a lot of people who don't have a lot of access, right? There's no print media anymore. We're trying to make this a good way for you to stay in touch with all the things you can be doing to protect yourself here in Westborough. So thank you very, very much for watching. Thank you, Shelby. Thank you, Aidan, who nobody else can see, but we can. And we'll look forward to see you on the next installment of Frank and Mary here in Westborough.
Bye, everyone. Be safe.
Bye.